I've been talking to a lot of healthcare organizations lately, and I found that most don't realize that the federal government released a new set of proposed rules as it pertains to HIPAA compliance and the HIPAA security rule. It's a considerably more detailed version of what security means for healthcare related organizations. And there's four kind of key pieces here that I think it's important to call out. First, there's mandatory implementation specifications. There's no longer addressable and required. Now you have to implement these particular changes. They're requiring enhanced risk analysis. It used to be that you could do a very simple risk analysis and call that your pen test, so to speak. Now there's significantly more details around what an organization has to actually do to protect itself appropriately. There's specific requirements now for things like the different sorts of technical safeguards that an organization has to deal with, for example, things like encryption of PII, or potentially things like multi-factor authentication, network segmentation, penetration testing. All of those things are now sort of different in this new rule set. Also, a new requirement that organizations that are subject to the HIPAA security rule have incident response reporting and planning done appropriately so that they can test and properly respond when a security incident happens. And last but not least, there's also a requirement around compliance documentation, meaning that organizations have to do a better job of actually documenting what they're doing to protect themselves from cybersecurity threats as a whole. So to sort of change the way this works, a lot of organizations need to really rethink how they're approaching cybersecurity and how it relates to the HIPAA security rules specifically. When an organization has to rethink this, there's a lot of work that goes into deciding how you're going to protect yourself. Spend some time doing a little research on the HIPAA rule that was released at the end of December 2024, and reach out if you need any help.